Hello and welcome to Pediatric Case Review. In this episode, we'll dive into the acute presentations of sickle cell disease among pediatric patients. Let's begin. Case number 1. A 16-year-old male with a history of frequent painful episodes and anemia presents to your clinic. Blood tests revealed abnormally shaped red blood cells. This patient's condition is most likely due to a mutation in which gene? A. Alpha-globin gene. B. Beta-globin gene. C. G6PD gene. D. Factor V Leiden gene. Correct answer. B. Sickle cell disease is caused by a mutation in the beta-globin gene, leading to the production of abnormal hemoglobin, known as hemoglobin S. This abnormal hemoglobin polymerizes under low oxygen tension, causing red blood cells to deform into a sickle shape. These sickle cells are less deformable, leading to vaso-occlusion, hemolysis, and the various clinical manifestations of sickle cell disease. Unlike mutations in the alpha-globin gene, which cause alpha-thalassemia, the beta-globin gene mutation specifically results in sickle cell disease. G6PD deficiency and factor V Leiden mutation lead to other distinct hematological disorders. Case number 2. A 17-year-old female with known sickle cell disease comes to the emergency department complaining of severe pain in her back and legs. This symptom is characteristic of which aspect of her condition? A. Osteoarthritis. B. Vaso-occlusive crisis. C. Hemolytic anemia. C. Venous thromboembolism. Correct answer. B. The severe pain in her back and legs is indicative of a vaso-occlusive crisis, a hallmark of sickle cell disease. In this crisis, sickle-shaped red blood cells obstruct capillaries and restrict blood flow, leading to tissue ischemia and infarction. This ischemia is the primary cause of the acute pain episodes seen in sickle cell disease. The pain can be localized to any body region, but is commonly observed in bones due to the bone marrow's high blood flow and susceptibility to sickling under hypoxic conditions. Case number 3. A newborn is suspected of having sickle cell disease based on family history. What is the most appropriate initial diagnostic test for confirming this diagnosis? A. Complete blood count. B. Hemoglobin electrophoresis. C. Bone marrow biopsy. D. DN. A sequencing. Correct answer. B. Hemoglobin electrophoresis is the gold standard for diagnosing sickle cell disease in newborns. This test separates different types of hemoglobin based on their electrical charges. In sickle cell disease, hemoglobin electrophoresis detects the presence of hemoglobin S, confirming the diagnosis. Unlike a complete blood count, which can show anemia but not the specific type, or a bone marrow biopsy, which is invasive and not specific for sickle cell disease, hemoglobin electrophoresis provides a direct and specific diagnostic method. DNA sequencing could theoretically diagnose sickle cell disease, but it is not routinely used due to higher costs and the availability of simpler diagnostic methods like electrophoresis. Case number 4. A 5-year-old child with sickle cell disease is brought to the clinic with a high fever. Given the patient's background, they are at increased risk for infection with what type of organisms? A. Viral infections like influenza. B. Fungal infections like candidiasis. C. Bacterial infections with encapsulated organisms. C. Parasitic infections like malaria. Correct answer. C. Children with sickle cell disease are particularly susceptible to infections from encapsulated bacteria due to impaired splenic function or functional asplenia. The spleen plays a crucial role in filtering bacteria and mounting an immune response, especially against encapsulated organisms like Streptococcus pneumoniae and Haemophilus influenzae. In sickle cell disease, repeated splenic infarction leads to loss of splenic function, increasing the risk of severe infections from these organisms. This vulnerability necessitates prophylactic antibiotics and vaccinations against these bacteria in children with sickle cell disease. Case number 5. A patient with sickle cell disease presents to the emergency room with sudden pallor, fatigue, and a dramatic drop in hemoglobin levels. Which complication of sickle cell disease is most likely responsible? A. Aplastic crisis. B. Hemolytic crisis. C. Iron deficiency anemia. D. Splenic sequestration crisis. Correct answer A. An aplastic crisis in a patient with sickle cell disease is typically characterized by an abrupt halt in red blood cell production, leading to a rapid and severe drop in hemoglobin levels. This crisis is often precipitated by infection with parvovirus B19, which targets and destroys red cell precursors in the bone marrow. The result is a sudden onset of severe anemia, manifesting as pallor and fatigue. In contrast, a hemolytic crisis involves the destruction of red blood cells, but not a cessation of their production, while splenic sequestration crisis involves pooling of blood in the spleen, not necessarily affecting bone marrow function. Iron deficiency anemia is less likely given the patient's underlying sickle cell disease and the acute nature of the presentation. Case number 6. A 12-year-old boy with sickle cell disease is brought to the emergency room after suddenly developing difficulty speaking and weakness on the right side of his body. Which complication of sickle cell disease is most likely responsible for these symptoms? A. Deep vein thrombosis. B. Renal infarction. C. Myocardial infarction. D. Stroke. Correct answer D. The sudden onset of speech difficulties and unilateral weakness in a child with sickle cell disease is highly suggestive of a stroke. In sickle cell disease, the sickle-shaped cells can occlude cerebral blood vessels, leading to ischemic stroke. Children with sickle cell disease have a significantly increased risk of stroke compared to the general population, often due to small vessel occlusion in the brain. This risk underscores the importance of regular screening with transcranial Doppler ultrasounds in children with sickle cell disease to assess blood flow velocities in cerebral arteries, as increased velocities can indicate a higher risk of stroke. Case number 7. A 15-year-old girl with sickle cell disease is admitted to the hospital with a fever, chest pain, and difficulty breathing. A chest X-ray shows new infiltrates in the lungs. What is the most likely diagnosis? A. Acute asthma exacerbation. B. Pulmonary embolism. C. Acute chest syndrome. D. Community-acquired pneumonia. Correct answer C. In patients with sickle cell disease, the development of fever, respiratory symptoms, chest pain, and new pulmonary infiltrates typically indicates acute chest syndrome ACS. ACS is a severe complication of sickle cell disease characterized by vaso-occlusion in the pulmonary microvasculature, leading to lung injury and inflammation. It can be triggered by infection, fat embolism from bone marrow, or pulmonary infarction. Acute chest syndrome is a leading cause of hospitalization in sickle cell disease and can rapidly progress to respiratory failure, requiring prompt diagnosis and aggressive management, often including oxygen therapy, antibiotics, pain management, and possibly blood transfusions. Case number 8. A 17-year-old male with sickle cell disease presents to the clinic with sudden onset flank pain and hematuria. Which diagnosis you should consider in this case? A. Urinary tract infection. B. Kidney stones. C. Renal infarction. C. Pyelonephritis. Correct answer C. In sickle cell disease, Renal infarction is a possible complication due to the occlusion of renal blood vessels by sickle cells. This can lead to ischemia and infarction of kidney tissue, presenting with symptoms such as flank pain and hematuria. The unique nature of the renal medulla, which has a relatively low oxygen environment, makes it particularly susceptible to sickling and vaso-occlusion. Renal infarction in sickle cell disease can be part of a vaso-occlusive crisis affecting multiple organs. Case number 9. A 2-year-old child with sickle cell disease presents with swelling, redness, and tenderness in the hands and feet. What is this condition commonly called in patients with sickle cell disease? A. Arthritis. B. Osteomyelitis. C. Dactylitis. D. Cellulitis. Correct answer C. Dactylitis or hand-foot syndrome is a common early manifestation of sickle cell disease in children. It occurs due to vaso-occlusive crisis in the small bones of the hands and feet, leading to pain, swelling, and inflammation. Dactylitis typically presents in young children with sickle cell disease and can be one of the first clinical signs of the disease. It's important to distinguish dactylitis from infections like osteomyelitis and cellulitis, which require different management approaches. Case number 10. A 30-year-old woman with sickle cell disease comes to the emergency room complaining of chest pain. Cardiac enzymes and EEG changes suggest a myocardial infarction. What is a unique aspect of myocardial infarction in patients with sickle cell disease? A. It is typically due to atherosclerotic coronary artery disease. B. It frequently occurs without significant coronary artery obstruction. C. It is usually related to severe hypertension. C. It is always preceded by chronic chest syndrome. Correct answer B. Myocardial infarction in sickle cell disease often occurs in the absence of significant atherosclerotic coronary artery disease. The pathophysiology is thought to involve microvascular occlusion by sickle cells and chronic anemia, leading to myocardial ischemia and infarction. This differs from the typical myocardial infarction seen in the general population, where atherosclerotic plaque rupture and thrombosis are the primary causes. It's crucial for clinicians to recognize this difference, as patients with sickle cell disease may present with myocardial infarction at a younger age and without traditional cardiovascular risk factors. Case number 11. A pregnant woman with sickle cell disease is being monitored closely. Which of the following complications is she at increased risk for during her pregnancy? A. Eclampsia. B. Preeclampsia. C. Gestational diabetes. D. Placenta previa. Correct answer B. Women with sickle cell disease are at increased risk for several complications during pregnancy, including preeclampsia. Preeclampsia is a condition characterized by high blood pressure and often proteinuria. It can lead to serious, potentially fatal complications for both mother and baby. The pathophysiology of increased preeclampsia risk in sickle cell disease is not fully understood, but is thought to be related to endothelial dysfunction, inflammation, and hypercoagulability associated with sickle cell disease. Close monitoring and management of blood pressure and other maternal and fetal health parameters are essential throughout the pregnancy. Case number 12. A 22-year-old male with sickle cell disease presents to the emergency department with a painful and prolonged erection lasting over 4 hours. What is the medical term for this condition? A. Erectile dysfunction. B. Orchitis. C. Priapism. D. Peyronie's disease. Correct answer C. Priapism is a serious and often painful medical condition in sickle cell disease, characterized by prolonged and unwanted erection of the penis. It results from vaso-occlusion of penile vessels by sickle cells, leading to impaired blood flow and prolonged erection. Priapism is a urological emergency that can lead to tissue damage and permanent erectile dysfunction if not treated promptly. Management may involve hydration, analgesia, and in severe cases, surgical intervention. Peyronie disease is a condition in which fibrous scar tissue forms in the deeper tissues under the skin of the penis. Orchitis is an inflammation of one or both testicles. Erectile dysfunction, also known as impotence, is defined by difficulty getting and keeping an erection. Case number 13. The 25-year-old woman with sickle cell disease is admitted to the hospital for a vaso-occlusive crisis. After several days of bed rest, she develops swelling and pain in her left leg. Doppler ultrasound confirms a deep vein thrombosis DVT. Which factor is most likely contributing to her development of DVT? A. Increased physical activity. B. Prolonged immobility. C. Dietary deficiencies. D. Dehydration. Answer. B. Explanation. Patients with sickle cell disease are at increased risk for venous thromboembolism VTE, including DVT and pulmonary embolism. Factors contributing to this increased risk include the hypercoagulable state associated with sickle cell disease and periods of immobility, especially during hospitalizations for vaso-occlusive crises. Prolonged immobility can lead to stasis of blood in the deep veins, increasing the risk of clot formation. Prophylactic measures, such as early mobilization and, in some cases, anticoagulation, are important in the management of patients with sickle cell disease who are hospitalized or otherwise immobilized for extended periods. Thank you for joining us. Stay tuned for more pediatric case reviews.